maybe 10-ish years ago, 8-ish years ago, we started contemplating moving all of our health centers onto the Epic platforms. And at that point, I began talking to colleagues at Kaiser about the possibility of them supporting us in this huge undertaking. Everybody said, well, you really need to talk to Kevin.
Where you want to make sure everybody gets that right to affordable, high quality, great outcomes, and equitable care. It's an ecosystem that's interconnected, and that electronic health record is the connector.
People have great things to say about Kaiser, but what they're mostly talking about is what Kaiser does for its own members. But with Kevin's support and the financial support they provided to us, it wasn't about Kaiser members. It was about the hundreds of thousands of mostly Medi-Cal patients that we served.
We had been having a conversation about how we could support our community clinics to obtain electronic health records. We approached Kevin for his thought partnership and how to make that come to fruition. He was very thoughtful and strategic. He not only leveraged his resources, but he brought in his team.
We had 8 health centers. We had implemented 7 of the 8 before the pandemic started. We actually ended up implementing the 8th during the pandemic. If you remember, the lockdown happened, the clinics were all open on a Friday, and nobody was there on a Monday. Because we had almost all of our health centers on this electronic health record system, doctors and nurses could literally be in their living rooms that Monday morning, open up their laptops, and being taking care of patients. This was a use of the tool that no one had anticipated, so that we were able to continue taking care of patients.
You just think about all the lives that were saved because these clinics now had the ability to do virtual care, and they had the ability to get to communities who were underserved. It is absolutely heartwarming, and I just feel honored and blessed just to be a part of anything that had that type of impact. And I think that's what Kaiser Permanente does every day in the communities that we serve. That's why I'm proud to be here.
Kevin's exceptional work here at Kaiser Permanente and in our communities is changing lives. There is no doubt about that. It's that work at the intersection between healthcare, technology, and communities what made Kevin so unique to receive the 2025 George Halvorson Community Leadership Award.
The George Halvorson Community Health Leadership Award is about demonstrating exceptional leadership to our communities. Kevin was selected because of his exceptional and visionary leadership. He was able to really advance the mission of Kaiser Permanente and connect resources with community health centers in a way that others couldn't.
Yvette came to me and said, who do you think would be good for this award? And she and I both looked at each other and said, Kevin. And so I'm just so incredibly proud of him for what he's done within the community, what he continues to do within the community, and what I know he will always do just because it's who he is.
Since we completed our implementation of 8 health centers, they've implemented in San Diego, Los Angeles, the Central Valley, Sacramento. So there's sort of ripple effect of Kevin sitting in this room saying, Ralph, I think you can do this. I think that the essence of Kevin's leadership is kindness, warmth, authenticity, faith, some humor thrown in. The kind of leader that Kevin is and the values that Kevin has, we need that more now than ever.